Hi, I'm Dr. Monica Ons-Cavazos.
Hi, I'm Dr. Sonny Cavazos, and welcome to our practice. I know I look very young, but we have tremendous experience here. Collectively, our group has performed nearly 7,000 weight loss operations. We've been accredited as a Center of Excellence in Bariatric Surgery. Our practice has been here in San Antonio for nearly 10 years, and we've taken care of patients from all over the country and Mexico, but San Antonio is home.
Many people are intimidated by the prospect of having weight loss surgery. But the more you learn about this process and the more familiar you become with our program, the more comfortable we hope you will feel. We have a team of experts to guide you through every step of this process so that you can realize your goals for your future.
Again, we're glad that you've come because we can help you.
Growing up in South Texas, I remember my brother and I as kids making that drive from Brownsville to Astroworld. And we lived for the Texas Cyclone. We just enjoyed that ride so much. It was one of our simple joys. And when a patient comes to me and says they're so excited that in the summer after their transformation, they're gonna be able to ride at Six Flags, it really hits home for me. Nobody should be deprived of that simple joy of riding a roller coaster. And nobody should be afraid of going to a restaurant and knowing whether or not they can fit in a seat. And when a husband tells me or at our center that they are afraid of going to work because they're going to get hurt because of their size and weight, it really hits home. It should be obvious by now, I think, the general problem of obesity and morbid obesity. It affects millions of Americans today. It increases the risk of cardiovascular disease, diabetes, and certain cancers. There's 400,000 deaths annually, almost second to smoking, and it's as lethal as a lot of cancers. Obesity is a real disease that needs an effective solution, John.
Going from the magnitude of the obesity problem down to an individual, we need to talk a little bit about numbers that go with obesity, and we usually use the word body mass index, or sometimes BMI for short. A typical body mass index, or a so-called ideal body mass index, is ranging from 22 to 25. And bariatric surgery has long been accepted for a body mass index greater than 35, but in our experience, we're seeing better and better results with bariatric surgery, lower risk, so that typically for us, the risk of surgery is less than the risk of the weight whenever the body mass index is greater than 30. New research is giving us a better and better understanding of the obesity problem. We're coming to understand that that old-fashioned prejudice about weight being a bad habit or a lack of willpower just isn't true. We're coming to understand that there are actually biological abnormalities that happen in this part of the body, not really here, that drive a person's weight to be maintained at this elevated, unhealthy level. And so what we've learned is that as people try to lose weight, they try to cut down their calories, the body will actually fight against that weight loss so that the body tries to get back to its abnormal set point. We like to use the picture of a weight thermostat that's set at too high of a level, and the body will always try to spring back to that elevated level in spite of the patient's best efforts. So we need something that's going to change that thermostat. We need something that's going to affect the biology. Right now, medicines and diet and exercise don't do that in a sustainable way, and so that's where surgery comes into the picture. Now, of course, we're going to remember that weight causes lots of other medical problems. The big ones are diabetes, high blood pressure, high cholesterol, heart failure, joint problems, and a host of other medical problems. We're also going to remember that the excess weight goes with a lot of social issues. There's definitely a prejudice problem, mobility problems, hygiene problems, problems with work and family relationships and all those things. And the good news is that as the weight comes down, those things are all going to improve. The natural thing to do once you recognize that your weight's a problem is to go on a diet to increase your physical activity. And in our experience, most people we meet have done that. They've done it 6, 8, 12 times. They've usually had temporary success losing 20, 30, 50 pounds, but the weight tends to come back over time. In fact, the latest research studies show that when you go on a planned diet, medically supervised, the 2-year success rate for our patient category is down about 2%. And so if you're in that 2% of success, that's fantastic. But if you're in the 98% where you've lost weight and it's come back, there's no reason to feel guilty. That's where we start thinking about surgery. And so yes, the obesity problem is a very serious one. It leads to a host of associated problems, and it needs serious solutions like gastric bypass, sleeve, or band.
Historically, there have been literally dozens of operations that have been done for intentional weight loss. However, over the course of the last several years, things have really gravitated to 3 main operations that are done. So let's talk about those 3 operations. The first of the 3 operations I want to talk to you about is the gastric bypass. Now, this operation has been done for a long period of time, since 1967, laparoscopically with a little incision since 1993. This is a complex operation. In this operation, what we're actually going to do is divide the stomach into 2 pieces. One proximal, very small stomach pouch. That pouch is about the size of a large egg, so a very small little reservoir for people to eat. What we're also going to do is divide the intestine and bring one of the cut ends of that intestine up to connect to the small stomach pouch. And what that does is it will reroute the way food goes through the intestinal tract, bypassing the majority of the stomach as well as the first part of the small intestine, which may have profound effects on certain disease processes like diabetes, for example. Now, this operation is very aggressive when it comes to expected weight loss afterwards. We expect most people after a gastric bypass to lose 70, maybe 80% of their excess body weight loss. Now, that's an important term for you to understand. Your excess body weight loss is the amount of weight that you have to lose, the fat, in other words. That's what we're trying to get rid of. That's what we're attacking. So we expect for this operation to produce about 70, maybe 80% excess body weight loss in most patients. The operation on the negative side of things does have some malabsorptive components, so you're going to have to take certain vitamins and minerals in order to account for this change in your anatomy. And the complication rate for this operation in most studies shows about a 10 to 15% complication rate. Okay, so about 10 to 15% of patients are going to require an additional intervention, whether that's another small procedure or readmission to the hospital, replenishment of vitamin and mineral levels, whatever it happens to be. But again, that's the gastric bypass. The next operation I'll talk to you about is a sleeve gastrectomy. Now, this is a newer procedure. This operation was actually part of a 2-stage operation previously called a biliopancreatic diversion with duodenal switch, but now these operations are being done as a standalone procedure. In this operation, what we're going to do is we're going to remove about 70, and some people as much as 80% of the volume capacity of your stomach. And what that does is it produces a severe restriction in how much that patient can eat per meal. Now, the other thing that it will do is it will actually absolve them to some degree of hunger early after that operation, because of the way that the production of Ghrelin, which is a hormone that's produced in the lateral portion of your stomach, is reduced early after that operation. Now, that's a tremendous adjunct to the power of the operation. So not only are patients not able to eat as much, but they also are not hungry early after that operation. You get the same effect actually after the gastric bypass. But in any event, as patients do regain hunger in the future, the restriction of the volume capacity of that stomach will reduce how much they're able to get in per meal. Ultimately, I would expect for this operation to allow you to eat about a child's portion of normal food once you've healed from the procedure. Now, the other thing about a sleeve gastrectomy that I should mention is it has a very low complication rate. Of all the procedures that we do, it has the lowest complication rate. Most studies showing about 2-3% complication rate. It's extremely low. The lap band is the last operation I'll talk to you about. Now, this operation involves the placement of a silicone band at the top of your stomach. This band has a balloon in it that we can adjust in effect, and you'll have a small port that sits below your ribs underneath your skin that we can access with a needle after we numb the skin, and we'll inject fluid into that port, okay, that little access port that you have under the ribs that I mentioned. And that fluid will go from the port through the tubing into the balloon, and as that balloon inflates, it will essentially tighten on the stomach that it's wrapped around. Okay, and as it tightens, it reduces the amount of food that you can eat per meal. Now, if we get it too tight, we can reduce the amount of fluid that's in there. So it's adjustable. It's also reversible. If somebody doesn't like the way it feels, or they don't like the results, or they're having problems from the procedure, then we can remove that band. And I think that reversibility is also an attractive aspect of the lap band. Now, this operation actually has the highest complication rate, ironically, of the procedures that we do. About 20 to 30% of patients are going to require some additional intervention in terms of a procedure in order to address the problems that they're having. But these operations produce as I say, a tremendous amount of weight loss. And the lap band produces about 40, maybe 50% excess body weight loss. The sleeve produces about 60 to 70% excess body weight loss. The gastric bypass, again, produces about 70, maybe 80% excess body weight loss. Again, going back to the complications, looking at a 2-3% complication rate for a sleeve, 10 to 15% complication rate for a gastric bypass, and about a 20 to 30% complication rate for a lap band. The gastric bypass and the lap band are reversible procedures. The sleeve gastrectomy is not. But these operations, as well as we try to do them, none of them are magic, okay? They're going to require the understanding and the execution of the game plan that we create together in order for a patient to realistically succeed and achieve the goals that they have when we set forth before we did the procedure, okay? And also, they will allow for patients to experience resolution of many of their medical problems, certainly improvement of these conditions, and then these improvements can be profound in many patients. And JJ, what were you going to say about those procedures?
The goal of weight loss surgery is not to lose as much weight as humanly possible. Okay, if that were the case, we just sew everyone's mouth shut. The fact of the matter is these procedures are done to help you prevent, improve, or resolve a number of other medical issues, primarily diabetes, high blood pressure, cholesterol, obstructive sleep apnea, and we're seeing tremendous results from these. We're able to actually cure type 2 diabetes with some of these procedures, and the rate is anywhere from 60 to 80%. We can normalize your hemoglobin A1C levels, where you're off your medications. This is a tremendous benefit, and if I can catch you within 5 years of diagnosis, the percentage goes up even higher. If you look at blood pressure, also 40 to 70% resolution. Hypercholesterolemia, same as that. And obstructive sleep apnea can be as high as 90%. So when you look at morbid obesity, it's not just weight loss. It's about curing or improving all these other medical issues or preventing them. And these medical issues are from head to toe. It's not just those. It's from migraines to gout and everything in between. Obesity affects all of the organ systems in the body, and that is our primary goal. This resolution is also meant to be long-term. This is not a temporary solution. This isn't for 3 months, this is for life. That is our goal here. If you look at the New England Journal of Medicine, published an article in 2004 in which 4,000 patients were looked at 10 years after weight loss surgery, a decade. And what they showed was sustained, significant improvement in cardiovascular disease, diabetes resolution, and most importantly, lifestyle. Their life was better. That's the goal. We want your life to be better. We want your health to be better, and we want you to be happier. And the nice little thing on top of that was a 30 to 40% reduction in mortality. Once you've decided that weight loss surgery is for you and you're ready to embark on this journey, it's imperative that you go to a bariatric program. Our program is a true multidisciplinary program. When you're taking care of bariatric patients, you realize it really truly does take a village to take care of these patients. They're very complex and they have multiple issues, both physical, mental, psychological. There's a lot of other issues that go along with it. So it's not just the surgeons. We also have a bariatrician in our program who's an internal medicine doctor who helps out with all the myriad of medical problems associated with morbid obesity. We have nurse practitioners, PAs, we have a registered dietitian, an exercise physiologist, psychologist, and on and on. It is a true program. And it's something that I think is extremely important when you're going around and looking for where you want to go. Also, when you're thinking about weight loss surgery, experience really counts. In our program, our surgeons have done nearly 7,000 surgeries. I think it's critically important. Experience is a must with this type of procedures. We have the safest surgery record. We've done more procedures than anyone in South Texas, and we specialize in all procedures, which is really important. When you're going around and looking at places, you want a place that offers everything, because what we want is what's best for you, not just what we can perform. And since we can do everything, we're happy to do whatever works for your best interest and makes you happy and is going to make you healthy. Our program is here for the long term. we're not going anywhere. We expect for you to be following up with us pretty much forever. And I think that improves your potential for success. And that's certainly our commitment. We have a long-term contract with you, and it is everyone's best interest that you do well. We're just as excited, and so is our staff, with your success. We have patient advocates that are available and ready at any time. We can do the homework for you on your insurance part. Let us take care of all of that and help you along your journey. There's an abundance of information on our website. Please feel free to visit that with other videos and give you a little bit more detail about some of the surgeries and the surgeons here. Thank you.